Today, now understand the Pap smear test. It is very rare test, but sometime doctor recommend this test for diagnosis of cancer or so many of infection. So let's understand what is Pap smear test. A Pap smear, which is also called a Pap test. This test is screened for cervical cancer. The test check for the abnormal cells in the cervix that are cancerous or have the potential to become cancerous. During a Pap smear test, your healthcare provider takes cells from your cervix to examine under a microscope for sign of cancer. A Pap smear may also detect certain infection and inflammation. The test is named for an American physician, Dr. George Papanicolaou, who developed the Pap smear. So, what is cervix? Actually, cervix is the lower part of your uterus that connects to your vaginal canal. Sperm travel through your vaginal canal and cervix to your uterus to fertilize eggs. During pregnancy, your cervix closes to keep the fetus in your uterus. The cervix opens during only childbirth. When you are not pregnant, your cervix makes mucus to keep infection which is causing bacteria out of your body. So let's understand what can a Pap smear detect. How many things it detect? Your healthcare providers perform the Pap smear test as a part of pelvic exam. This test checks for cervical cancer, potentially precancerous cells in the cervix, human papilloma virus, a common sexually transmitted disease (STD) that increase the risk of cervical cancer. Now, who needs a Pap smear test? Actually, women and anyone assigned female at birth should start getting Pap smear starting at age 21 and human papilloma virus, okay, at age 30. So it's very important for you to prepare for the Pap smear test. It's very important slide. Something that you do in the days before a Pap smear can affect test result. Your result can be false positive or false negative if you don't take any kind of steps before Pap smear test, because some kind of preparation you need to take before the test. So here we go. First of all, not have vaginal sex for 2 days before your exam, okay? Not use any kind of tampons, vaginal creams, medicines, birth control forms, jellies, pills, lubricants, douches for at least 2 days before the test, okay? So this is the warning if you want to get your result very clearly. So you need to take the steps, you need to prepare for yourself. Schedule the appointment at least 5 days after your period ends, okay? So let's understand how is a Pap smear test is done by doctor or by the physician. Actually, during the procedure, your healthcare provider insert a speculum into the vagina, but you may feel a bit of pleasure. This metal or plastic tool holds your vagina open so your provider can see your cervix and uses a small brush or spatula to gently scrape cells from your cervix, just like a biopsy. But actually it is not painful, but you will probably feel some kind of discomfort with some kind of pleasure. So now understand what do the Pap smear result mean. There are 2 types possible result from a Pap smear you can expect, normal and abnormal. So discuss it one by one. First of all, normal Pap smear, if your results are normal, that means that no abnormal cells were identified. Normal results are sometimes also referred to as negative. If your results are normal, actually you probably won't need a pap smear test for another 3 hours. And it sounds really good, you know. But the abnormal pap smear result test mean if your test results are abnormal, this doesn't mean that you have a cancer. It simply means that there are abnormal cells on your cervix, some of which could be precancerous. But as well as there are several levels of abnormal cells: atypia, mild, moderate, severe dysplasia, carcinoma. Milder abnormal cells are more common than severe abnormalities. Depending on what the test result show, your doctor may recommend something for you. So consult your doctor about the medicine, consult your doctor about your result. Okay? So don't search on the Google or the YouTube. Thank you very much for watching our video.